Signs of pregnancy. Many couples are very careful about pregnancy planning, calculating ovulation, and trying to have a baby. From the end of each menstrual cycle, women listen to their bodies sensitively. And if conception has occurred, literally in 8 to 10 days you can notice some early signs of pregnancy. This is due to the influence of pregnancy hormones and changes occurring in the uterus during implantation. In particular, sometimes pink discharge occurs, indicating the introduction of the embryo into the thickness of the endometrium. Pregnancy or menstruation. Many women confuse the initial, earliest signs of pregnancy with changes typical for the beginning of the menstrual cycle, since both conditions feel very similar. Literally 8 to 10 days after ovulation and the release of a mature egg into the fallopian tube. After meeting it with a sperm and conception, successive changes in the female body are formed. They are associated with the influence of the key hormone of pregnancy. Therefore, approximately 8 to 10 days after ovulation, unusual symptoms that occur may be early signs of pregnancy. However, if a test is carried out at this time, it can give a negative result, since the pregnancy hormone initially rises in the blood plasma and only after a while begins to filter into the urine, where it is determined by tests. The effect of pregnancy hormone. Almost immediately after conception, a woman's body continuously and in increasing concentrations produces the pregnancy hormone human chorionic gonadotropin. It is he who leads to various changes in the body of the expectant mother, causing headaches, morning sickness, and much more. These signs may begin to appear about 8 days after ovulation or from the moment of implantation of a fertilized egg into the lining of the uterus. It is important to note that the period of 8 to 10 days is the approximate time of implantation of the embryo. Each woman has an individual period. Sometimes it can lengthen, and the first signs will appear later. In addition, not all women in general may experience malaise or other signs associated with an increase in the level of pregnancy hormone. This does not mean at all that conception has not occurred and that the embryo does not develop. Do not worry ahead of time. The most important signs will be a delay in menstruation and a subsequent positive pregnancy test, and not different sensations. From ovulation to conception, as ovulation occurs, natural changes form in a woman's body that prepare the body for possible conception and implantation of the embryo into the uterine wall. The density of cervical mucus changes, sexual desire increases. If ovulation occurs during the period of intimacy without protection, the chances of successful conception are as high as possible. As the fertilized egg moves towards the uterine cavity, there are no special changes in sensations. But as it penetrates into the uterine cavity and the process of introduction into the mucosa begins, the level of hormones that support pregnancy increases. Certain changes can be noted. Changes in secretions during implantation. Implantation bleeding in the form of spotting or pink discharge is an early sign of pregnancy, which usually manifests itself 6 to 12 days after conception. Implantation of the embryo into the uterine mucosa is accompanied by partial dissolution of the endometrium, which slightly increases the discharge. Minor stains on the linen or minor bleeding are possible. Most women consider this to be the beginning of menstrual discharge, since this time may fall on the period before menstruation or at the time of the beginning of a new menstrual cycle. Ovulatory bleeding or stains on underwear is a common occurrence, and there is nothing to worry about, since the discharge stops after a short period of time. Signs of early pregnancy. Many women notice signs of early pregnancy, although their severity may be insignificant. Frequent or increased urination, even if a woman does not take a lot of fluids, can be one of the symptoms of pregnancy that can occur days after ovulation. An increase in blood flow to the kidneys due to hormonal changes leads to an increase in urine production, which is more actively filtered and more often separated. This indicates that conception has taken place, and the embryo is implanted and develops in the uterus. An increase in hormone levels after conception can slow down the digestive process and lead to constipation or a decrease in the number of bowel movements. This is another sign that pregnancy may have occurred. But digestion is also significantly dependent on the type of food consumed, so this symptom cannot be considered particularly reliable. Morning sickness is the most common symptom in the early stages of pregnancy. Although this is typical for 6 to 8 weeks, some women may experience nausea shortly after implantation, making it an early sign of pregnancy. New body sensations. The expectant mother may have headaches and dizziness due to fluctuations in hormone levels after ovulation. Mild pre-fainting conditions may also form, which are considered a common and early symptom of pregnancy. Sensitivity and taste sensations may change. Craving or aversion to certain tastes and smells of food develops. It is also possible to feel constant hunger or satiety, changes in appetite. An increase in hCG levels after implantation can make the breast more sensitive, dense, and edematous literally after 1 or 2 weeks from conception. Other symptoms a woman may experience a couple of weeks after ovulation include tingling and discomfort around the nipples. Gradually, the progesterone level rises, regulates mood, and causes drowsiness during the day. This, in turn, can form a feeling of weakness or fatigue. Thank you for watching the video. Like, subscribe to the channel, and write a comment. See you in the ICE story.